started last Tuesday with our first live video. So we had a good time doing it. So hopefully you guys join us today. Today our topic is going to be talking about, we're going to be talking about kids. We're going to be talking about the development of kids from the day that they're born all the way up into their teen years, talking about the development phases with them and how to keep them healthy throughout those phases, along with just knowing how to navigate the situation. There's a lot of things that happen when things happen and what to expect. This is really good for first-time parents or even parents that, are starting all over again. Everybody's going through their phases. Personally, I have 3 little boys. Their ages 6, 2, and 3. The last 2 are Irish twins. They're 363 days apart. So we've definitely battled our lack of sleep, but we love it. It's a lot of fun. So once again, I'm Dr. Hash. I'm with Breakaway Chiropractic. We've been here in the Frisco community for 13 years. We love the fact that we're able to serve our community from kids to teenagers to sports to adults. We see them all. We see babies. The youngest I think we've seen in our office is about 2 days old, and then the oldest I think we've seen is 93 years old. So we have a lot of fun doing it. So what is chiropractic care for children? So chiropractic care for children is taking care of the spine, the body, the brain. So everything that we do with our spine with the adjustments deals with the nervous system. Our brain connects to our spinal cord, and our spinal cord has nerves that come out of it, which then translates the ability for our body to speak with other parts of the area, other parts of our body. So it allows us to think, it allows us to move, it allows us to walk. Throughout the development phases, it allows the prefrontal cortex to grow and also learn and grasp new things, because from the time we're in the womb to the time we come out of the womb, there's a lot of changes that happen for a baby from day one. Common misconceptions about chiropractic for kids is the fact that it can be too rough for kids. In all honesty, when we are adjusting kids, it involves less pressure than trying to push into a ripe tomato. So when you're trying to push into that ripe tomato, that's as much pressure as we're putting onto the spine. The differences between an adult getting adjusted compared to a kid getting adjusted, they're very drastic. So there's not a lot of twisting involved with it. It's more of a gentle pressure and just pushing through that. They don't need a lot of pressure to move the spine, and it's also a lot more malleable. So it is easy movement for the spine altogether. Okay. So the first thing that we're going to talk about is we're going to go through the infant stage from 0 to 12 months. There's a lot of challenges that occur at this time. Birth is a natural, and it's also physically a demanding process. There's many infants that come out of the womb with misalignments that people don't realize. What happens is coming through the birthing canal, there's a lot of pressure on both baby and also the mama. So coming out of that canal, there's a lot of different pressures that come onto the spine throughout it all the time. I think the question is, don't they need to move? Yes, the body does need to move. Absolutely. Body needs to move, the spine needs to move, because when you're in that womb, there's a lot of compression on the spine as well. So it's not really about helping in regards to different ailments, but it's really heightening their immune system and also their nervous system to fire back and forth to kind of keep them going, which is a great take on that. So misalignments at birth, there's a lot of things that can occur. It can affect feeding, it can affect digestion, can affect sleep, and also development. So as we're able to take pressure off of the spine, it can help our nervous system fire a lot better to allow our body to do the natural things that it's meant to through the growth phases. Throughout that development of that 0 to 2 year range, there's a lot of developmental leaps that occur throughout the baby's journey. So there's 10 different developmental leaps that occur. There's a great app that's out there called Wonder Weeks that kind of helps you navigate through those phases, especially as a new parent. For us, we used it a ton, and it helped us navigate through those phases, just kind of figuring out, okay, why is our baby fussy, or what's changed over the last couple of weeks, because the development changes very drastically, especially day to day. So some of the 10 phases that happen, there's a world of senses, which happens around week 5, world of patterns, which happens around week 8, transitions is about week 12. World of Events happens around week 19. World of Connections will go at 26. World of Categories, so where they're able to recognize different shapes and colors, will start at 37 weeks. The World of Sequences, just putting everything into order and understanding what sequences are, at 46. And then the World of Programs, where they start to understand those sequences a lot better, that'll start at around week 55. And as you see, I'm looking down, I do have some notes in front of me. These are, there's a lot of specific weeks and things that come into play with that. So something to definitely look into. I think the app is like $1 or $2. It's not very expensive, but not always is it perfect to the week or the month that your child is. But for us, it was always really good in regards to a week or two after. So generally the week before or a week or two after, at least you'd have a gauge as to where you're at and what could have changed, because at any moment our babies can't talk, but they can kind of let you know what they like, what they need, based off of how their cries are. And it's a new phase for everybody. For a first-time parent, you're getting to learn your new baby, and for a baby, you're getting to learn both of your parents, your mom and your dad. It's a lot of changes for everybody all together. So how chiropractic care can help in that is, as we get adjusted, it can help alleviate pressure from the spine and the nervous system. So we're going to jump into toddler years, or even from 0 to 12 months, what happens throughout those phases. So generally, when it comes to motor skills, there's a lot of milestones that occur from month 4 all the way to 18 months. So generally, anywhere between 4 and 9 months is when your baby just starts to sit up. Now, take these months for a grain of salt. Some babies do it faster, some babies it takes a little bit longer. This does not mean that your baby has developmental issues. Every child is different. This is just a guideline, and you'll probably notice that the range of months can be a little bit further apart. So, and I say this because, especially for my firstborn, he took a little bit longer with everything. So when it comes to sitting up, I think he took about 8 months altogether. Standing with holding on to things and grasping onto things. Some babies can do it as early as 5 to 6 months. Some babies it takes 10 to 12 months to do. Generally, that age range is 5 to 11 months from being able to hold on to things and stand and pick themselves up. Crawling is the next phase that happens. Happens anywhere between 6 to 10 months. Sometimes babies can take a little bit longer with that as well. But crawling is a big phase. Even before crawling, a lot of times you hear about tummy time and why that's important. One of the biggest reasons for tummy time is it helps engage their neck muscles and helps those neck muscles get stronger. It allows them to pick up their heads. And if you notice, or you're familiar with the spinal curves, it helps create the C-shaped curve in their neck, because then that acts as a loading mechanism for their discs and for their nerves, so that way there's not so much pressure on it. As you notice, as teenagers and kids grow up, they start growing through the adolescent phase. Even adults were like this a lot these days. So back to what we talked about last time in regards to forward head pressure, we really want to make sure that we're getting all those things stronger. Josue, thank you. We appreciate you bringing your son Luca in here. He's been amazing to see grow. I think he's about to be 2 years old now. So we appreciate you trusting him with his spine, with our care, especially throughout his development. So we appreciate you. I'm glad you're here watching us today. Now, continuing on with that from tummy time, crawling. The crawling stage is huge to creating another curvature in our low back, which is the lordosis of our low back. So it helps get that curvature into the low back. So that way, as we work our way up to crawling and standing and pulling up, then we're able to kind of have more stability throughout our body. Those curvatures are so important, because as those curvatures are developed, then it acts as more shock absorbers for our spine. So in our neck, we have a C-shaped curve. In our mid-back, we have a reverse C-shaped curve. And in our low back, we have another C-shaped curve. It basically creates this curvature here, and then another reverse curvature in the middle, and then another C-shaped curve going back, okay? So that's where that's important for tummy time and also for crawling, okay? Now, getting into walking. Sometimes with walking with help, a lot of children can do that from 8 to 11 months. every kid is different. So aiding them and helping them hold their hands, allowing them to walk, it helps get their feet and their stability, getting their proprioception right. Thanks, Rock, for stopping by. I'm glad we're able to adjust both of your children as well. It's great taking care of families. Sorry, I'm trying to go back and forth and also kind of tend to the comments that are coming along as well. And then also standing alone. Standing alone can happen anywhere from, as early as 9 months to 11 months, and then walking. Walking is a big thing. It's one of the bigger milestones that occur for kids to be able to kind of move along through their life and what they're doing. So walking can occur as early for some as 10 months and sometimes even for as late as 15 months. All three of my children, they didn't start walking till 15 months. My firstborn didn't start walking till 15 months and 3 weeks. Second one was at 15 months and 2 weeks. And then the last one didn't start till 15 months. So as a parent, can it be alarming? Absolutely. But as you go through the phases of development, every child is different. These are guidelines that are set aside. And as you'll notice, like I said before, there's a big age range in regards to that. So chiropractic care in toddlers are very important because toddlers are learning how to walk, they're learning how to run, they climb, they jump. For me, they jump off the couch every 5 minutes, no matter how much you tell them to stop. Those can lead to tumbles, falls, things like that, which then puts more stress on their spine. So for children, getting adjusted once a month is huge. In certain instances, can they get adjusted more? Absolutely. But for children at this young of an age, getting them adjusted once a month is huge. That way it takes pressure off their spine. And throughout these phases, they're also growing. One of the biggest things is your spine grows and your muscles grow with it. Typically, your muscles grow slower than your spine because as your spine grows drastically, the muscles start to pull and pull and pull, and they don't know what to do. So a lot of times you hear about growing pains. That's part of what growing pains are. Your bones are growing and your muscles don't know what to do with the amount of bone growth that's occurring. So as kids are getting older and things like that, that's where those growing pains happen. So you'll get a lot of pain in the legs, the feet, the calves. All those things definitely play a part into that. So chiropractic at a toddler's age can definitely help with posture development, and also can help with leading with coordination and reducing injuries. Also, what's happening is throughout these phases is the development of the prefrontal cortex of their brain. So the things that these kids are learning from day one until, they're toddlers, 2, 3, 4 years old, it's all development of that prefrontal cortex. So a lot of times people use screens. It happens. Generally, that I usually tell people, try to limit the screens the first year. Obviously, if you're out and it keeps them calm, use it as necessary, but don't resort to that for the main sequence of holding your kids to being good kids. Because at the end of the day, it slows down the prefrontal cortex. If any of you have ever watched Cocomelon before and actually look at the freeze frames and watch your kids, they get into a trance. They're like this. So what's actually occurring in that stage, and what these kids programs have found out, is every 3 to 5 seconds, they're changing the frame. So the picture completely changes, and what they're looking at completely changes, which completely engages them. It's great for engagement, but also what happens is they get into kind of a trance to where their brain's not functioning and they just get stuck. So then they start developing tantrums in regards to, hey, I want this, and they kind of become addicted to it. So definitely use it when you need it. I mean, we're not saints. We use it all the time as we need it, but make sure we limit them to how long they're using it as well, okay? Getting into school-age children. Now that I have a 6-year-old that's in kindergarten, I see these things happening a lot more. So from ages 4 to 12, you get a lot of challenges in regards to this area because you start carrying heavy backpacks. They're gonna start sports at around 4, sometimes even 3 years old. They're sitting a lot during school. So, kids don't sit in proper posture. They don't even know what proper posture is. They're kids. So they kind of slouch, they hunch, they do all these things that puts more pressure on their spine. And they're also going through their main growth phases as well, okay? Sitting for long periods of time is also a hindrance to that. I hate to say it, but kids are getting younger and they're having more devices, cell phones, laptops, computers. I think a lot of these kids get a laptop by the time that they're in by the time that they're in school, they're at a laptop, so they're like this, and they start getting engaged. I know my 6-year-old, he got to do laptop time at school, which is awesome for him. Just got to make sure with posture, it becomes a big part into that. Okay, so once again, as development happens, how does chiropractic care helps? It's helping with development from the stresses on the spine from carrying heavy backpacks or starting to getting into sports and falling. Kids are prone to bad posture. It's the nature of it. They're never going to be 100%, neither are adults, but if they can get them to be in proper posture 80% of the time, 60% of the time, you're doing a better job than a lot of people. And also limiting how much their time on their phone and their screen times, because as you get into the teenage years, they're on their phones a lot. That is literally their lifetime. They're literally their lifeline. So if you take away their phone, it's the end of the world. But when we're like this, curves that spine, starts to put more pressure on the spine. So just like last video that I said, we've seen kids that are 12, 13, 14 years old with worse spinal curves than a 60-year-old. More degeneration, more arthritic changes that are causing issues in the long run. And numbness, tingling, we see it all. You'd be surprised at the amount of things that we see and ailments that we see in kids as well. Even if you watch my posture throughout this video, it changes, it varies. It's never perfect, but gotta be 80% would be better, but 80% of the time is what I generally tell people. Getting into the teenage years, like I said, we're going through rapid growth spurts. We're getting a lot taller. We're going through puberty stages. So there's a lot of hormonal changes that occur. I'm not saying adjustments are going to change your hormones, but they can help regulate those hormones through your brainstem. So a lot of times when you get adjusted, if you've ever been adjusted before, you'll get a big dopamine release to where you're like, okay, so that excitement release to where you're like, whoa, what was that? That is a dopamine release. Then you get a big relaxation phase, which is an uptick of serotonin to where you're just calm and relax. So that's that serotonin to help your body and your brain and your nerves calm down. Then you also get a decrease in cortisol. So what is cortisol? Cortisol is a stress hormone. So a lot of times when we attribute stress to a lot of things, we get a cortisone uptick. So as that cortisol increases, we get into more of a sympathetic phase to where we're in a more of a flight stage to where we're always on edge. So getting adjusted can help. Once again, I'm not saying it's gonna regulate your hormones, but it can help get your body to do what it needs to based off of keeping your spine in proper alignment. So there's less pressure on the spine, less pressure on the nerves, less pressure on the spinal cord and the brain stem and your cranial nerves. It can help regulate a lot of different things. As we go through that, as we're starting to play more sports in the growth factor, there's a lot of things that occur too. A lot of times people talk about scoliosis. Scoliosis is a big thing that gets thrown around a lot. When we're in school, they do the spinal checks to where they bend down and they check the spine to see if it's curving one way or another. If the nurse finds any type of curvature, they call it scoliosis. I'm really not a big fan of the term scoliosis unless it's above a certain degree. So yes, I like the term lateral flexion curve more. Lateral flexion curve 2 to 3 to 4 degrees. Can it cause issues? Absolutely. Is it true scoliosis? No. But there's other factors that play into it. Your growth, the way that you move, but also the postures that we are throughout the day. So if your kids are going through a big growth spurt and they sit like this all the time, and they're sitting like this 4, 5, 6 hours a day, and then they're doing it on a daily, do you think they can develop a lateral flexion curve? Absolutely. Our body and our brain is a compensation machine. So if they're sitting like this, eventually they're going to start leaning to the left. The spine is going to follow that, and then as they grow, they'll start growing like that, and that can lead to those issues. So we have to retrain our body, our brain, our spine, and the way we sit. Because as we sit through growth phases, or the way that we move and run through growth phases, we have to do it in proper form. It's, once again, if we sit like this, or if we're sitting at school and we're sitting like this all the time, it leads to changes within our body. So as an adult now, if your parents ever harped on you for posture, there's a reason for it, because you do grow that way. So start making those changes and start getting in the habit of kind of talking to your kids about posture and making sure they're trying to do it in the correct way. Because even sitting or standing, if you stand and you shift your hips, As time goes on, you become more dominant to that, and our brain takes us to that phase all the time. So as we get into the long-term benefits of chiropractic care, there's a lot of improved immune function when it comes to getting adjusted. So, not saying that it's going to cure sickness, that's not what I'm saying at all, but what it's going to do, it's going to help your body work from the inside out to allow your immune system work a lot harder, because as there's less interference within your brain, your spine, your nervous system, then your body is able to do what it's meant to do from the inside out. So as your immune system heightens, you're going to get less, you're going to get sick a lot less, and it plays a key role in boosting that immune system. It's been shown that, especially throughout our office, that kids that get adjusted once a month or regular care tend to get sick less, or when they do get sick, they're able to recover a lot faster, which, as you know, as a parent, keeping your kids home from school when they're sick is not the easiest thing. You're going to get better sleep quality. And why is sleep quality important? That's where growth occurs, is when they're sleeping. So proper alignment helps kids sleep better, and it's essential for growth and development through all these phases. Throughout those teenage years, kids are growing rapidly, their hormones are changing so much. So we got to be able to help them throughout those phases, and that's what your nervous system does. If you can keep your brain and your spinal cord and everything else healthy, then it helps in the long run altogether. Also, when it comes to, people talk about a hunchback, okay? A lot of kids are like this these days. So we need to get everything stronger. What happens is, a lot of times when we're in this phase, you'll get that bump right there, okay? So what that bump is it's actually your body coming like this, and it's your longest spinous process that's putting more pressure onto your skin. As there's more pressure onto your skin, what then happens is your brain starts to lay down more fat deposits. That's where that hump develops. And that hump develops over a long, long period of time. It's not something that happens overnight, but you want to be aware of that, so that way that doesn't occur and put more pressure onto that area, that transition zone between C67, C7T1 into that lower neck and mid-body as well, okay, or mid-thoracic. So with chiropractic care, it's also going to reduce the risk of chronic conditions. So when we talk about chronic conditions, obviously scoliosis is a chronic condition, and then also joint pain, because as there's more pressure on your joints, it doesn't matter the ages. If there's pressure on your joints and there's prolonged pressure on your joints, over time, that leads to more chronic pain. Most issues with most people are developed from little things putting pressure on your spine, which then leads to chronic pain. If you talk to most people as they're adults as to what they're dealing with when it comes to pain, a lot of times they'll tell you, hey, I don't know what happened. I just bent down one day and picked something up, and it just started and it never went away. Most issues start to where things that happen, like a crick in your neck, it'll last like 2-3 days, go away. Or pain in your low back, it'll last 2-3 days, go away. As time goes on, 2-3 days will last into a week, will last into 2 weeks, and then one day it just kind of sticks, and then you get into that routine. Then it just becomes your normal. But in reality, it's not normal. It's not normal at all. Like, I have 12, 13-year-olds with back pain. But why? So getting down to the reason as to why allows us to help figure out what exactly is going on. And not saying everything is due to posture, but 80% of the time, it definitely can be. And as you make those postural changes through those growth years and keeping your spine in proper alignment, then you're going to have a better opportunity to have less pain and also grow properly. And what, I don't know if anyone's kind of been to an ortho throughout their phases of scoliosis, but they tend to monitor. And as they monitor, what they suggest is going to PT and physical therapy, which is great. Going to physical therapy, going to a chiropractor, working on strengthening, those are all the things we need to do, because they don't want to operate on young kids, not at all. So that's why they harp on going to see a physical therapist or a chiropractor that does strengthening to help throughout those growth phases, because that's a last resort. Nobody wants Harrington rods put within their spine and then having to help that get straight as time goes on, because if you've ever seen x-rays of that or ever seen that surgery done or know someone that's had it, it is not easy. nor is it fun, because as that happens, you have those there for the rest of your life, and it just puts and wreaks havoc on your body for the long run, okay? As opposed to allowing your spine to grow a certain way so that way it's not wreaking havoc internally. We don't want that to happen, so take care of it early. Just like braces on your teeth, our spine is the same way. It takes time to get back to where it needs to be, but it can get there, okay? So I don't know if anyone has questions that are watching, but I appreciate you guys taking the time to watch. Every stage of childhood has its unique challenges, and chiropractic care is something that's safe and a natural way to support your children from the early ages all the way up until they're a teenager, all the way up until they're adult throughout their phases of life. So if you found this information helpful, please like our video. If you get a chance, please share it with throughout your social media, or share it with other parents. If you guys have any questions about anything, please comment or send us a message. Let us know how we can help you or your children or your family, anything like that. Please subscribe to our channel, and please let us know if there's any different types of videos that you do want to see. Like I said, I'm trying to start doing this on Tuesdays, come up with different topics to talk about. Just really want to help as many people as we can, and I feel like this is the best way to do it. Everybody learns from their experiences, and we just want to help out the community all together. And if you are looking for a chiropractor or have questions about chiropractic, please let us know. I don't care where you are. If you come here or if you go somewhere else, it doesn't matter, as long as you're getting proper care and the care that you need. And that's the biggest thing. Every person is different. Every chiropractor is different and suits a different person. So we're here for you. And that's pretty much it for today. So thanks for joining. Hope you guys have a fantastic Thanksgiving. Eat lots of food. I know I will. And we have lots of family coming in town. So you guys enjoy. Have a safe, happy Thanksgiving. And we'll catch you next time. Take care. See you later. Bye.